Cardiovascular disease, type 2 diabetes, and obesity are well known, and this week the American Heart Association issued an advisory that formally established the definition for a new condition called CKM Syndrome. Here to explain all of this is KSTP's health expert, Dr. Arkell Giorgio. We are glad that you are here to talk about this. So tell us a little bit about what is this condition?
Right, so this condition is called CKM Syndrome, and that stands for cardiac, kidney disease, and metabolic syndrome. And metabolic syndrome includes obesity, type 2 diabetes, high cholesterol. So none of these are new diseases.
Right.
What's new that the Heart Association put out is combining them all together into a new syndrome. And that's important because they are all linked. Each of them creates a risk for the other. So if you have heart disease, you have a risk for kidney disease. If you have kidney disease, you have a risk for heart disease. And you can create those connections between all of those conditions. So they put them all together so that they look at a person holistically.
It makes a lot of sense. I mean, when they're doing this and they're trying to figure it out, I mean, that was sort of the goal of making a new definition and putting a defining area in this whole thing.
Absolutely. You know, we have to remember that heart disease is the leading cause of death in the country, almost 1 million deaths per year. And I was stunned at these statistics. Every 40 seconds, someone has a heart attack. Every 3 minutes, somebody dies of a stroke. So the goal of these new guidelines is to drive more prevention, more intervention at the appropriate time so we can get ahead of it so that we can decrease the deaths associated with heart attacks, strokes, and other types of cardiovascular type diseases.
So, and that makes a lot of sense to do that because when as they put this advisory together, they outlined a lot of the stages to help patients, doctors better understand what the risks are, and then what to do about it as well.
Right. So there are 4 formal stages, but I look at it as 5 because stage 0 is where we all want to be, which is no risk factors, we're healthy. That doesn't mean do nothing. It means make sure that you have all those lifestyle factors in place: exercise, healthy diet, healthy weight, etc. But then stage 1 is when somebody has excess body fat, maybe they have prediabetes. Stage 2 is when somebody actually has type 2 diabetes, maybe high blood pressure, kidney disease. And then you add to that, these keep building on each other. Stage 3 is when somebody has all of the above, plus they have heart disease but don't have any symptoms yet. And then stage 4 is when they have symptoms associated with heart disease.
It's kind of nice to see this classification with these different stages in there. So how does the new classification really support and encourage a regular person to kind of stay healthy through all this?
Well, you know, I think it's easy to understand. I could outline it right here on this screen, and it's easier for patients to understand, and frankly, it's a lot easier for doctors to understand as well, and it's easier for them to have that conversation. So one important thing for patients to do is to talk to their doctor about what is my stage and risk of heart disease. And I'll point out that this was about 30 pages of recommendations, and so I'm just picking out the most important ones. But the screening and the risks actually decrease from age 40 to age 30, so we're considering risk at an earlier age. And maybe one of the most important things people can do is that if they have any of these conditions, make sure that your heart doctor is talking to your kidney doctor or your diabetes doctor, because it's uncoordinated, fragmented care that puts you at risk for worse outcomes. So if we coordinate it all together, we'll have healthier health.
Yeah, that makes a lot of sense, is to make sure everybody is talking together and working on the same page, and it's your health.
And all these organs are connected.
Yeah, they are. Dr. Arkell Giorgio, thank you. Very interesting today.